Lagos State had an experience with a major pandemic threat in about 2015 with the West African Ebola outbreak. Luckily, we had a strong surveillance team on ground, and we were able to rapidly find the contacts of the index case before it exploded out of control. We realized at that time that had we not managed to contain Ebola, that Lagos was a very vulnerable city in terms of its demographic profile. It's a low-lying coastal megacity with certain attributes that would accelerate any infectious agent spreading very quickly through the communities. Even though we managed to contain Ebola in 2015, we were very worried that it could come back, or as the WHO predicted, and still predict, that we were to expect a major global pandemic within 5 years from 2015. And the WHO were correct. They called it Agent X, a new pathogen, and certainly we were exposed to COVID-19. And what happens during a pandemic is that you have your standard health infrastructure, which is to take care of day-to-day medical activities within a city. So that will be divided into public facilities and private. But when you have a pandemic, you suddenly have large numbers of people presenting with illness, and we call that a surge. So is your health infrastructure able to absorb a sudden increase in numbers of sick people presenting for care? So the Lagos State government had been building diagnostic special laboratories, because you can't manage these dangerous pathogens in ordinary laboratories. We had been upgrading our isolation facilities. We had been training staff. We'd been carrying out simulation exercises. What happens if somebody comes into Lagos through the airport with a highly contagious pathogen. It was a multi-sectorial strategic plan. So our health budget caters for health security in general, and then there's a special segment of the health budget that is to prepare Lagos State for a biosecurity threat or a pandemic. So obviously we had a fairly robust pandemic budget before, but COVID showed us that we needed to inject a lot more money into the COVID response, and so we had to take funds from other parts of our budget to supplement. We also realized that the government was not going to be able to manage COVID on its own, because government facilities are in the minority. There is at least 400 government facilities, and there are 4,000 private facilities. So private facilities outnumber public facilities by 10 to 1. So if we were going to have an effective COVID-19 response in Lagos, it was clear that we had to involve the private sector, both in terms of laboratory diagnosis, logistics, oxygen, and care, and then even vaccination. But the private sector was able to carry a lot of the burden from government, because there was a huge demand for testing, there was a huge demand for oxygen, there was a huge demand for care and logistics. And so that we sort of created a COVID economy in the private sector. And from that COVID economy, we were able to sort of supplement the government spend on COVID-19 response. The Lagos State has a budget. That budget is to be shared between health, environment, agriculture, transportation, communication, a multitude of needs in Lagos State. So then you come and you look at your health budget, and your health budget again has competing demands. Like I said earlier on, there's everybody. We must cater for everybody in Lagos, from the pregnant woman to the elderly, and including visitors. What do we need to do? Because the budget is not buoyant enough to carry everything. So we need to look for third income streams. We need to privatize some of what we do in Lagos. It's not good enough just to sit down after Ebola and say, well, we survived Ebola, we're good. We didn't do that. We prepared. Similarly, it's not good enough to sit down after 4 waves of COVID and say, hey, we're good. We got awards left, right, and center. No. There's not much COVID activity at the moment, but we're still building. And we are training and expanding our biosecurity unit at Yaba. We're designing new facilities. We're adding new international diagnostic capacity, like sequencing and bioinformatics. We're ramping up our human resources and specializing, getting doctors and scientists and logisticians specializing in pandemic preparedness. We are establishing the One Health paradigm, which means that we work very closely with Ministry of Environment to look at environmental threats, work very closely with the Ministry of Agriculture to make sure that we're looking at the food that's coming into Lagos. We're working very closely with physical planning so that Lagos is built in a way that is not too crowded and not too congested. And of course with Ministry of Justice, because we need to develop policies, guidelines, and laws. We used laws during COVID to control the scenarios.